Uh, Senator Alsobrooks.
Thank you so much to Mr. Chair and Ranking Member Gillibrand. Like so many of my colleagues, I am a part of what they call the sandwich generation, which means that I am caring for a 20-year-old daughter and also really privileged to balance that with the caregiving of my parents. I also hear daily from Marylanders who are caring for their own family members, and I know how important the responsibility can be. I share it with each of you as having a mother who is suffering from dementia. My father was her caregiver, and he has most recently turned ill himself. And so it is the case that so many adult children who are balancing work, child care, and caregiving, it can be a really awesome responsibility. And we know that a shutdown causes so much fear and turmoil for so many people who are just wondering what tomorrow will look like. Now, the Older Americans Act exists to bridge the gap for caregivers, to ensure that older adults can live independently and with dignity, and to support the families who care for them. Last year, Congress got to the 5-yard line on a bipartisan reauthorization of this critical law before a tweet by Elon Musk undermined the progress. And so at the very same time that families are being requested to do more with less, we know that this administration has moved to dissolve the Administration for Community Living, weakening the agency responsible for coordinating the support nationwide. Our responsibility is clear. We must reauthorize and strengthen the Older Americans Act and ensure the programs and agencies that carry it out have the staffing and stability needed to meet rising need, especially during a shutdown that, in my opinion, has gone on too long. So I look forward to hearing from each of you today and discussing how we can protect and strengthen the systems that our seniors depend on so that they and their caregivers are supported and not left behind. The first question for Ms. Patton or Mr. Montalegre is about the ACO cuts and shutdown. The Administration for Community Living is the backbone of the Older Americans Act. It keeps the nation aging network coordinated and functioning. But over the past year, we've seen sweeping staffing reductions along with a proposal to dissolve the agency altogether and fold its functions into a larger, less specialized division at the Department of Health and Human Services. Now, layered on top of these cuts, we're in 36 days into a shutdown that has frozen or delayed essential work across the agency. Ms. Patton, what does it mean for families and caregivers when the ACO loses staff, loses structure, and is unable to operate its Older Americans Act programs?
So thank you for the question. I think that's where the Older Americans Act, where we see its greatest strength, is because it does start at the federal level through state units on aging all the way down to the local level. And, during the pandemic, the AAAs, we were required to be very nimble and to come up with ways in which during trying times or challenging times, whatever the reason, to make sure that individuals and families had the services and supports that they need. So when we think about the Older Americans Act and the way it is designed and the importance of the reauthorization, it's making sure that no matter what is happening around us, that we have the ability to serve the people in our communities, to take care of the individuals in a timely way, and to think about caregivers. And so, that is the value of the Older Americans Act, is because there is this federal perspective and the authority to administer the Older Americans Act, but then it works its way all the way down to the local level where we can be innovative and responsive to the needs of individuals.
Thank you. Now, Mr. Sappington, first of all, I want to thank you for being here today and for the work that you've done in Maryland and keeping our community exercised and moving in programs like the one that you've been involved in. And your testimony, I think, underscores something really important about the Older Americans Act, and it's how it helps people to live well today and also helps people to have hope for tomorrow. As someone who's living with Parkinson's, you know personally what it means to rely on the day-to-day support for long-term search for better treatments. So I want to ask you, how do the services that the Older Americans Act supports, like transportation, caregiver resources, and community exercise programs, help people with Parkinson's maintain function, stay connected, and live well day to day?
Thank you for the question. I'll try to do my best to answer that. The The OAA provides vital support in terms of the transportation and the caregiver support that people with Parkinson's desperately need. And the fact that it is a federal program and obviously needs to be supported and reauthorized to prevent any disruptions in access to critical supports like home care, transportation, or caregiver assistance. I'm also going to say that the National Plan to End Parkinson's Act would be something that would go hand in hand with the OAA because the OAA provides what people need now, the services they need to get from point A to point B to be connected and to continue to stay active, and as well as the nutrition and the caregiver support. So the OAA is vital to people with Parkinson's and those that have neurodegenerative diseases in our older population. They both go hand in hand with the National Plan to End Parkinson's Act. And one is basically providing people what they need now to live with their older Americans, to live with their neurodegenerative diseases. And the other looks for a permanent end to those diseases. So they kind of work hand in hand. One's the now cause, one's the future cure for it. So I can't say enough about the need for both.
Thank you.
Thank you very much for that question.
Thank you so much.